Good morning दोस्तों. Welcome to Saral Sociology. Let's see what is medical sociology. Medical sociology is a field that examines the social dimensions of health, illness, and healthcare systems. It explores how social factors such as culture, social class, gender, and race influence health outcomes, healthcare experiences, and the overall functioning of the healthcare system. Medical sociologists analyze the interaction of medicine and society to gain insights into how social structures and processes shape health and healthcare. Let's go through the key concepts of medical sociology. And the first is social determinants of health. Medical sociology emphasizes the role of social determinants of health, which are the social and economic conditions in which people are born, live, work, and age. These determinants, such as income, education, occupation, housing, and access to healthcare, have a profound impact on health outcomes. It is important to note that medical sociology recognizes that health is not solely determined by biological factors but is profoundly influenced by social conditions. For example, individuals from disadvantaged socio-economic backgrounds may face higher rates of chronic illnesses due to limited access to healthcare and unhealthy living conditions. The next aspect of medical sociology is medicalization. Medicalization refers to the process by which human conditions and behaviors become defined and treated as medical issues. Medical sociologists examine how certain aspects of life, such as childbirth, aging, or mental health, are medicalized, leading to the expansion of medical authority and interventions. For instance, the labeling of normal aging as a disease or the categorization of certain behaviors such as shyness as psychiatric disorders reflects the medicalization of social phenomena. Similarly, the increasing medicalization of childbirth has resulted in the rise of interventions and medical procedures during childbirth that may not always be necessary. The third key concept related to medical sociology is doctor patient relationship. The doctor patient relationship is a crucial aspect of medical sociology. It explores the dynamics, power imbalances, and communication patterns between healthcare professionals and patients. Medical sociologists examine how social factors shape this relationship and influence patient satisfaction, adherence to medical advice, and overall healthcare outcomes. For instance, cultural differences, language barriers, and social stigma can affect effective communication and trust between doctors and patients. Next key concept related to medical sociology is healthcare disparities. Medical sociology explores disparities in healthcare access, utilization, and outcomes among different social groups. These disparities can be based on factors such as race, ethnicity, socioeconomic status, gender, or geographical location. These disparities refer to differences in access to healthcare services, quality of care, and health outcomes. For example, marginalized communities may experience higher rates of certain diseases and face barriers to accessing adequate healthcare services. Friends, the significance of medical sociology lies in its ability to provide a critical lens to understand health and healthcare beyond individual biology. By considering social factors, it offers insights into the complex interplay between social structures, cultural norms, healthcare systems, and health outcomes. To further illustrate all above concepts, consider the example of diabetes prevalence and management. Medical sociologists may examine how social determinants such as income, education, and food access contribute to the higher rates of diabetes in low income communities. They may also explore how medicalization influences the use of pharmaceutical interventions versus lifestyle modifications in diabetes management. Finally, in a nutshell, we could say by studying medical sociology, we can develop a deeper understanding of how society influences health, healthcare, and well being. This interdisciplinary field provides valuable insights for healthcare professionals, policymakers, and researchers to address health inequalities and promote social justice in healthcare systems.